Good day to you all and welcome to yet another edition of our podcast here at Humana People to People. It's 30 November 2021. Now, as people around the globe commemorate World AIDS Day on December 1, 2021, Humana People to People has chosen to enhance the spotlight surrounding HIV and AIDS. The theme for World AIDS Day in 2021 is End Inequalities, End AIDS, and Pandemics. Social, legal, and economic inequalities constantly act as barriers in effectively saving the lives of most at-risk population groups globally. Engaging the subject of inequality and pandemics is of critical essence considering how the COVID-19 pandemic has dragged on since its outbreak, with access to vaccines for national citizens being defined by one country's state of being poor or highly industrialized, a set development which has reversed gains in ending AIDS. Over the past 20 years, we have seen positive gains being registered in HIV prevention measures, which have resulted in a reduction of transmission rates and the number of people dying from AIDS-aligned opportunistic infections. In addition, about 27.4 million people out of the 37.7 million people living with HIV and AIDS were on treatment as of 2020. As an organization, Humana People to People developed HIV and AIDS program concept meant to support countries to fight the HIV and AIDS pandemic through various interventions, helping us to have a journey in memory of the HIV and AIDS. We are joined online by Humana People to People Chairman Snoore Westgard, who will be part of the discussion on our today's conversation. Let's cross over to Elton as he's having that conversation with the Chairman of Humana People to People, Snoore Westgard.
Welcome once again to our session where today we are going to focus on a discussion on one of the major topics in the areas of health, which is HIV and AIDS. Humana People to People has a vested interest in fighting HIV and AIDS, which had started in 2000 with a pilot program that has been fighting HIV and AIDS in sub-Saharan Africa, particularly Zimbabwe. The success of the first program has seen the expansion of the total control of the epidemic, which is known in short as TCE, in Africa, as well as being shipped into India and China, be it with information awareness, education, HIV testing, fighting discrimination. The program has undergone some remodeling as well, such that it best suits and responds to the emerging needs of HIV and AIDS, the gaps that has emerged now, and also fitting to the global UNAIDS targets of 90-90-90, as well as UNAIDS 95-95-95. So today, we have been joined by none other than the chairperson of Humana People to People, who oversees the work of Humana People to People, covering 29 members who are spanned across the whole globe of Humana People to People. As he is a busy and well-involved person, we have managed to have an opportunity to discuss about the role of Humana People to People in fighting HIV and AIDS. So, without wasting much of your time, I would like to invite the chairperson to present himself, as he is going to share with us his name, his past, as well as his present engagement. Now, I invite you to say a bit about yourself.
Thank you so much, Elton. It's a great pleasure and privilege to be able to talk to you and also to talk about HIV/AIDS and pandemics on the 1st of December, the World International AIDS Day. And I can say, well, first of all, my name is Snoore Westgard, and I have been working in international development since 1980. So started in Guinea-Bissau building schools And then after that, I moved to Angola, where I was a project leader for a vocational training center for, you can say, war orphans, children that became orphans because of the civil war at that time. And then after 3 years in Angola, I worked in Zambia as country director for almost 10 years. And there, one of the very, you can say, interesting and good projects that we had many things, many good projects, but one of them was starting the first Hope Center. And Hope was Humana People to People's first response to HIV/AIDS. Or you can say we had responded to HIV/AIDS through our other projects by mobilizing communities, spreading messages and information, but this was the first dedicated HIV/AIDS project, which started in 1996 in Zambia. So today there are many Hope projects, and as we will tell about later, and you also said something about, then also the TCE, Total Control of the Epidemic program. So you can say that's working in Africa was my first, you can say, knowledge about HIV/AIDS, and my first meeting with people affected by HIV/AIDS. And when I later in 1998, when I moved to work at the headquarters of the Federation Humana People to People, then actually I again got a very, very fantastic chance to lead the work to start up the pilot project of TCE, Total Control of the Epidemic, which was in Zimbabwe. And then later I moved and worked for 3 years in Botswana, leading the project there and also guiding the project in other countries in Southern Africa. So, so that was a very exciting time. I think I'll tell more about that later, but where we actually gained a lot of experiences of how to work with people affected by HIV, how to work with communities and address the pandemic or epidemic at that time, and under those circumstances that the world, or you can say Southern Africa, was vis-a-vis the HIV epidemic at that time. And then, so I did that for a few years. And then in 2004, I got the opportunity to move to India and work with Humana People to People India to expand its programs and its projects here. So, so here, that's what I've done since. And from 2007, I was also the Chief Executive Officer of Humana People to People India, which is my current position.
Interesting. Now, on the 1st of December, as we have said, that's when the World AIDS Day is marked globally. The theme for this year is End Inequalities, End AIDS, End Pandemics. What do you have to say as the chairperson of Humana People to People to such kind of an ambitious theme?
I think it's a very, very good message to give on the 1st of December, on the International AIDS Day, because I think end inequalities, it's to realize and acknowledge that really the way that you end pandemics and also HIV/AIDS is by promoting greater equality in the world and among people, and to fight inequality. That is I 100% think that's a very, very appropriate message. And of course, it's a message, and we know that it will not happen overnight. We know that it hasn't happened in the past decades. In many ways, inequalities have just increased in the world, and the difference between rich and poor has become even bigger today than it was before. So we are not naive and say, you know, we'll kind of only advocate for greater greater equality and to fight inequality, and that's the only way to fight pandemic, fight HIV/AIDS. We know that while we are advocating and fighting for greater equality in the world, we have to work with people to face the problems and the challenges that they face from day to day. So people are still suffering from HIV/AIDS, people are still getting infected by HIV, people are infected by TB, people are suffering from TB, from malaria, and now also the COVID-19 pandemic, which has impacted the whole world in the past 2 years. So, and we have seen very clearly how inequalities everywhere has impacted you can say both the response to the pandemic, but also how people have been impacted by it. Even in a country like the US, it is very clear that people from poor families, often people from Black families, are to a higher degree impacted by COVID-19 because of poor background, because of nutrition, different kind of access to healthcare, poor access to healthcare. And now when the rich part of the world has been more than 50% vaccinated, then still, most of Southern African countries are only vaccinated, I don't know, 4 to 10%. So it's a huge difference in the access to vaccines in the world today. And that is because of inequalities between countries and between people. So I think it's a very, very appropriate message.
Interesting. Now we have brought in a very interesting perspective where inequality, actually, it is a global issue. It is both existing in the North as it is also existing in some pockets or almost everywhere in the global South. Now, with your own reflection on this inequality, what do you think it needs to be done when we are looking at responding to AIDS as well as responding to the issue of the pandemics? For instance, we have the COVID-19, which have just touched as of now.
I think AIDS has come a long way, but when you look at the history of AIDS from the first years, in the early 80s, when it was kind of discovered I think in gay communities in USA, New York, Los Angeles, and so on, and to where we are today, it has always been, you can say, a fight, first for recognition, first among the communities in the rich countries that were impacted by or were infected by HIV. They really had to fight for recognition, for acceptance, for access to healthcare, because they were marginalized. They were a marginalized group. And then when HIV/AIDS was seen Uganda, around the lake areas and so on, there it was discovered first. Then, of course, we had the whole question of countries, poor countries in Southern Africa being overwhelmed by HIV/AIDS. And it was a long, hard fight to make people kind of recognize, that even the question of treatment, for years, the discussion was that in poor countries, people cannot adhere to the very difficult regimen of treatment. Some people advocate, say, no, it's not, you shouldn't test people because what can they do if they're tested? Then they will, don't have access to medicine, so why test them? And so overall, it was necessary to, fight for access to information, access to testing, access to, before treatment was available, access to proper information about how to live positively, how to boost your immune system, how to survive HIV. Because many people who actually got infected in the 90s who did not have access to treatment at that time, but because they followed you can say common sense knowledge, or they followed regimens of how to boost their immune system, how to not get reinfected, how to live positively, as we said at that time. They survived until treatment became available and are still surviving today, 30 years later. So I think it's important to see how this was really a fight among the people with supporters all over the world to move towards greater access, greater, even in poor countries should have access to treatment and information and testing and so on. And today we are a different place because now most people in most countries have access to antiretroviral treatment because it is produced cheaply, generically, and that's why they have country programs, national AIDS control country programs have taken up treatment as one of the ways to both help people survive and also fight the spread of the virus. So yes, it's really important to continue to fight poverty, because ultimately, or not fight poverty, but fight, with poor people to get a better life, to fight inequality so that distribution of wealth is more equal in the world and people get access to resources, and also countries get access to resources so that the inequalities can be overcome. So yes, I think you could say basically the first thing is we have to continue to fight for a more equal world, fight for people to overcome poverty and to get a better life. That is number one. But at the same time, we also have to work with people to survive the situation they are in, because poverty and inequality is a reality in our world today. And we also have to work with people to find local solutions, to galvanize their strength and togetherness to overcome the overcome the challenges and problems that they face in their lives and communities.
Humana People to People, in its key thematic areas, basically it responds to the major effects of poverty, be it with the education, be it with health, rural community development, environment, among many of the other initiatives it implements. As you assess the effects of poverty, to what an extent do they affect the efforts which are directed at ending AIDS and other associated pandemics or epidemics?
Yeah, that's it's a long-term thing, but of course you can take a question like education. Yeah. So now many people are poor because, apart from economic structures and globalization and so on, that in many ways sustain and also increase inequalities, then of course for an individual and for a family, then access to education is one of the ways that you can get out of poverty, that you can create a better life. And we are seeing in many African countries, in India, we can see that families that are basically illiterate, they send their children to school, and if these children actually succeed in learning and get a good education, then they can bring their family out of poverty and a more decent life. So, and that also means access to better information, understand the information about HIV/AIDS. It means for marginalized communities that engage in sex works and sex work and you can say different kind of behaviors that lead to more infections, drug use and so on. Then of course also the fight of a better life. I mean, poverty sometimes leads to these things. So fighting poverty also means fighting for a more decent life for people and alternative engagement, as instead of sex work, getting other kind of jobs where they are not putting their lives at risk for HIV infection. But overall, I mean, education, community development, these are all actions that enable communities to get access to better information, to get access to each other, because many of our projects also involves that communities get together and actually work together to face challenges. And when people are alienated and one by one, then it's much more difficult to actually understand the challenges. And for example, what happened in Africa in the early part of the HIV/AIDS epidemic, the stigma and the fear of HIV/AIDS led to further spread of HIV/AIDS. But when communities got together, they fought the stigma, they overcame the stigma and started supporting their fellow community members who were infected by HIV. And it became an open question. Then you could see that these communities became much better equipped to tackle HIV/AIDS. So I think it's on many levels. It's difficult to answer like just one thing, because one thing is to generally, fight with people around the world for a better life, for a more equal society. And we do that in our day-to-day projects and bit by bit changing the world towards a more equitable world. But on the other side, these concrete actions in the communities today also change people's lives for the better. I'm not saying they go from being poor to being, wealthy or so in one day or a week, but this of actually being together, finding solutions on your day-to-day problems, that is definitely helping people to have a better life.
Now, as the world is preparing or is about to celebrate or to mark the World AIDS Day in 2021, we are still at the middle of the COVID-19 crisis globally. And more so, when we look at the global south or the southern hemisphere, the issues to do with the COVID-19 coming to an end are very difficult actually to perceive as of now. What is the position of Humana People to people with regard to ending COVID-19? When you see it as the chairperson of Humana People, what do you think it needs to be done and how?
So what we have seen is that the world, or you can say science, first of all, science with support from governments have actually managed to develop a vaccine in the course of less than a year. That is fantastic. And we have seen that these vaccines are effective. They've reduced the infection rate, and also when people get infected, then it reduces the death rate among people who are infected. So all in all, there's no doubt that vaccine have had enormous impact, even though now the virus is going up again in some of the European countries. You can see that there are much less deaths than before in the first two waves. So I think, the stand of Humana People to People is that vaccines should be made available for all the people around the world. And we have joined forces in what is called the People's Vaccine Alliance, which is actually an alliance of organizations that support. The main message is that vaccines should be made available for all people around the world, and that have to be done by sharing intellectual property rights. That means the technology on which the vaccines are produced should be shared with other countries that have the capacity to produce vaccines. And WHO, they have a mechanism to actually receive this technology and to share it with and provide technical support to countries in the south so that they can produce their own vaccines. And that is, as far as we can see, that's the only way forward for mass production. We've already lost almost a year because this could have been done a year ago, and a much larger proportion of the global population could have been vaccinated, and a lot of suffering and deaths could have been avoided. But unfortunately, the rule of profits and private property and so on is so dominating that even in a global crisis like the pandemic, then common sense is not prevailing, but instead the sense of private property and profits are prevailing, and that's very disappointment. That's also very disappointing, you can say, where that many of the rich countries' leadership has not taken the lead in this. They totally only protected their own population and do very little to provide support to the global south or to the poorer nations. And the only exception is actually the UN system. You can say WHO and the UN, they have really shown leadership and are advocating for a much higher production of vaccines and distribution of vaccine to the poorer countries. So health workers, the vulnerable, can be vaccinated, and then ultimately the whole population. So that is our stand. We are part of the People's Vaccine Alliance, and we think that the whole world should have access. So everybody in the world should have access to vaccines.
Interesting. Now, Coming back to what we have already mentioned earlier on, that Humana People to People started to develop the first HIV/AIDS response in the Hope Humana project concepts, which you were part of implementing or leading when you were part of the or part of development aid from People to People Zambia, which is a member of Humana People to People. And later on, when you came to the Humana People to People headquarters, you were part of developing the other concept, which is total control of the epidemic, still focusing on fighting HIV and AIDS. What motivated Humana People to People to develop the HIV/AIDS program concepts early 1990s?
Well, you can say we started noticing the impact of HIV/AIDS in the late 1980s, very late, I would say 89, around that time, when we could actually started to see some of our own employees or people in the community dying of unexplained disease, or because at that time it was not diagnosed as AIDS, but people were dying. And then throughout the early 1990s, this increased. And we could even see, people went for testing, for example. It was not easy to get a test, but sometimes you could get a test. If you were negative, you got a report. If you were positive, you never got a report, because the doctors were not willing to tell the person who tested positively that he was positive. So the reports went missing, or they simply didn't get a report. And so this was kind of the level in the early 90s in many of the African, sub-Saharan African countries. So there was no, there's absolutely no, what can you say, readiness to address the situation, and stigma was very high, and even doctors and healthcare workers were not prepared to deal with HIV/AIDS. So, but I would say it was a very personal choice, because then you can say in the mid-1990s, some of our very close colleagues died of AIDS, and we could see it, and we also tried to find ways to help them to get access to care, to get tested, and we could see there was a lot of misinformation, sometimes superstition, and it was really hurtful. It was really tragic to see. So we said we have to do something, and then we decided to create this concept HOPE, which is a center which provides information. It provides outreach activities to schools, to communities, information, education about HIV/AIDS, and then the center itself has testing facility. And it invites people who test positive to join what we call positive living groups. And then these positive living groups supported each other. And we also got all the kind of information that all we could get hand on to support people of how to live positively. What kind of nutrition was good to boost your immune system, what kind of minerals and vitamins should you take to also boost your immune system. We found doctors who were willing to work with HIV/AIDS patients, so that every time a person was sick, we could refer a person to that doctor, who actually saved really many people by it was not treating HIV/AIDS, but treating the opportunistic infections that person had, so that the person got well again and can continue to live. So all this happened from the HOPE centers, and I think one of the major results of the HOPE Center was also to invite people in as donors, government officials, other interested other organizations, to learn about HIV/AIDS and to meet people living with HIV. That was one of the most important, you can say, weapons we had, actually. That was the people living with HIV themselves, who were willing to give their testimony of how it was, how they survived stigma. It was not interesting how they got infected, because there were different ways people could get infected, but how they survived, how they fought stigma, how they stuck together in the positive living group, and so on. And this really touched many people to overcome their stigma of HIV/AIDS. So that was the hope model. Then I can say that what happened afterwards is that even though we loved our hope centers, we thought they were fantastic, you know, they really made a difference for the people involved, and there also some impact outside the people involved, as I said, you know, impact on donors, on other partners and so on. But it was a drop in the ocean because the problem was so huge. Now also figures started to come out, you know, that 15% of the adult population in the country was HIV positive, 20%. When we went to Botswana later, it was said that around 30% up to 35% of the adult population were HIV positive. That was later calculated, so it became less than 30 because, you know, you can't test every person in the community. You have to have different parameters of how you calculate the percentage of a population. But we could see that even with those kind of percentages, you know, 10 to 20 percentages, it was hope. It was a drop in the ocean, as I said. So we wanted really, what could we actually do? You know, we thought, what could be done? How could people actually take control of HIV/AIDS? And then we said, well, one way of doing it was basically to go door to door, mobilize each and every person to take control. Because I mean, if everybody got tested, knew their status, then those who were negative, they could stay negative by avoiding risky behavior, protecting themselves, using condoms and so on. And then those who tested positive, they could do, you know, they could follow the regimen of positive living, taking care of their health, avoiding reinfection, you know, make sure that they boost their immune system, access better nutrition and social support, which was very important. So we said, how could this happen? You know, how can you mobilize every single person in a community or in a country to get the right information, education, counseling, and testing? And then we came up with this idea that what about if we actually made a program where we went door to door, where we targeted every single person in the community. And it sounded crazy. And then we said, yeah, it's crazy, but that's what it takes. And we actually made a plan. We made a map of the whole Southern Africa. And we said, okay, and then we made a structure. So the structure was that one unit, you can say TC unit, was an area of 100,000 people. And in that area, a group of 50 TCE field officers should be employed or deployed to go door to door. Each field officer responsible for 2,000 people, going door to door, informing about HIV/AIDS, then mobilizing people to get tested, and so on. And we said this will take 3 years because it's not like the first time you knock on the door, people come running and say, yes, let's get tested. It takes time. You have to change whole communities. So it was also involved in a lot of, apart from going door to door, there was also a lot of community mobilization. We had talk shows every Saturday where, the whole community was gathered together in the village. And then there were different speeches by the local community leaders. There were entertainment and so on and so on. So this was the concept, and it was based on a very simple line that only people can liberate themselves against AIDS, the epidemic. And the whole idea was that, it's only the individual together with his community and his support group, of course. So it's, the single, you can say the individual in his collective support group who could overcome this. And it had to be kind of almost a bit like a guerrilla warfare. We're also inspired by the being in Southern Africa and knowing that many of the history of many of the Southern African countries was also this kind of liberating their countries by going door to door and mobilizing people to fight the colonialists. So this was also something that many, you can say, old freedom fighters in the government in Southern Africa could recognize and could really align with that. Some of our partners were a bit shocked by the kind of radical approach, but when they saw it in the field and could see what this meant to change, how it really changed the the whole attitude towards HIV/AIDS and the readiness for action in communities across Southern Africa, then it was actually a program who got lots of partner support over the years. So, and I think, yeah, so in that way, that's how it started.
That's quite an interesting perspective, looking back at what actually got into the mind of Humana People to get started with responding to HIV and AIDS. Now, somebody might be asking, okay, there is so much reference to total control of the epidemic, which is TCE. They might now be asking, so what is TCE and what is the idea behind the concept?
Yeah, as I said, so only the people can liberate themselves from AIDS, the epidemic, and which meaning that, you know, you have to center on the individual person and his community. And so that's the basic concept. And then we developed, you can say, of course, to do this, there had to be a very strong structure, because to reach 100,000 people, that and do it several times over 3 years, and then mobilize, you know, the majority of people, or at least a critical mass, to get tested and know their status, that would demand very dedicated field officers who understood the whole strategy, and also understood the disease, the virus, and the disease AIDS. So there was a structure where we had the 50 field officer. They were then led by a troop commander. So one troop commander had 50 field officers. And then in the country, for example, in Botswana, we were having this in half the country. So we had 9 troops, and then we had one like overall corps. We had 3 divisions, a division organizer division commander, sorry, for each division. And then the division commander has his team of deputies and also special forces, so that there was monitoring, training, everything going on. So one thing is to have a great idea, and then you also have a great system for the people to take up. So we had this, what we call the perpendicular estimate system, which was actually a list of 6 demands that people had to live up to. So they should know everything there was to know about the virus. They should get tested. They should if they tested positive, they should take a stand to living positively and survive. If they tested negative, they should take a stand to stay negative and not infect others. And also, of course, positive people should also not infect others. And then, and so on. So this was kind of, you know, people were mobilized to around these 6 fairly simple demands, but complicated, anyway, complex to mobilize people to adhere to. And then, so that's like, so you can say that, and then we had a lot of, I think there were 20 or 25 small booklets with all kind of, you know, reading material that there were TCE libraries in communities, so people have access to proper information. You know, to operate such a system, it's very important with some very good structures that enable, for example, in the case of Botswana, we had 450 field officers and some, 30, 40 other employees. So to make that effective and actually to reach the goals and to do all the activities in each and every field, then a very good structure is necessary. So those 2 things TCE had. It had the content, and you can say the strategies for how to mobilize and enable people to take control. And then it also had a very robust way of organizing and implementing the project, monitoring and implementing the project.
That's interesting. You have touched on the structure of the TCE, where it appears to me that it has this military face. When you look at the names, the troop commander, division commander, corps commander, why the military names? Why the military impression?
It was because we acknowledged that to fight HIV/AIDS, you really needed a lot of, what can you say, it could not happen just by doing a little here and there. You need a massive effort. And I think by using these, you can say, military kind of structures and names, it emphasizes the seriousness and that this was a fight and people needed to be disciplined. And if you're going to make such a large-scale program covering, our ambition was to cover the whole of Southern Africa, then you really need to organize it as in this way. But the interesting thing with the TCE, because some people kind of said, oh, it's a very top-down structure. But what it is that when you create structures that enable people to be in control, or you can say these structures enable our field officers because they knew the objective and what was supposed to come out of the program. So you could see our field officers were incredibly innovative. They come up with all kinds, strategies and new innovations and how to mobilize the community. And they learn because they learned from the community. I mean, some of them, that was the first time they met a person infected by HIV. They met, and the meeting, for example, one, I never forget the story where a field officer, she said that she went into a home and she saw a person on the ground in that home, and he was HIV positive, and he had all the signs, and then she talked to him, she counseled him, and he said, yes, I have been tested, I am HIV positive, and but I never told my family. And then she then counseled him and said, wouldn't it be good that the family knew, because then I can counsel them that you are not a danger to them. They just have to use basic things to protect themselves, and they can give you proper care instead of you lying here and nobody knows who dares to talk about it. And the impact on that family was tremendous, because just being able to talk about it openly, they started to caring for him much better. He was in tears because suddenly this stigma and this silence around his disease was broken down. So these things happen, and this was impacted that field executive enormously, and these kind of encounters they had every day. So they became very, very capable at what they were doing. And so because of the structure and the discipline in the whole structure and system, you can say they were given the freedom to really innovate and do what was necessary to reach the goals. And they learned how to be together with the people and how to actually work with the people to find solutions. So yes, it was actually worked, you can say, almost better than we thought. And many things came out that it was actually a very, very good system.
Interesting. Now, when we look at the philosophy of TCE as a Humana People to People program, with its slogan being based on only the people can liberate themselves from HIV/AIDS, the epidemic, how relevant is such a slogan or such kind of a conceptualization in ending AIDS today when we consider the current trends which are emerging out of the many fights and gains achieved over HIV and AIDS?
See, I think the slogan stands, because ultimately for every disease, everything, it is ultimately an individual responsibility. But then in your family, in your community, as a part of a family, a community, a society, to take control of any epidemic or HIV/AIDS. So I think the slogan still stands that yes, it's only people can take control. And then you can say, then of course it's also governments, scientists, society as such who take responsibility. You can say in COVID, what was special about HIV/AIDS was the enormous stigma attached to it. And because it was a sexually transmitted, mainly, of course, it also spreads in other ways, but it was mainly a sexually transmitted disease. So that's why there was so much stigma, so much taboo. So you can say the complexities around how to address it. And that's not the case with the COVID. COVID is like affecting everybody, and it's airborne, or I mean, it's through droplets. So it's a totally different thing. But anyway, also here, you have to go to get your vaccine. And of course, we know in some countries that's even a conflict. It's a political issue or whatever issue it is, or a religious issue or whatever. But you have to move yourself to the place where you can get the vaccine to get vaccinated. It's an individual choice and an individual action. And of course, the more of your family and your community that support you in this action, the better. So, so that is one thing. Yeah, I think so. So in that way, but then you can say also today, even the HIV/AIDS epidemic has changed its character, and also TCE has changed. It's no longer what we call the classic TCE. That time when there was no access to treatment, where there was a lot of stigma, a lot of misinformation, then and it was spreading in the general population. Then TCE, as I have described it, was a very, very good and appropriate strategy. I'm sure it still is in many settings. It would still be a very appropriate strategy. But the way you can say governments and the donors, the partners, and the also limited resources available. So now it is much more targeted interventions, meaning people who are more at risk are targeted specifically. People are mobilized to test, and then through testing, you access sexual partners of people who have been tested. So in that way, it's a more, you can say, effective way of reaching people through what is called index testing. So TCE has also had to adopt to these new strategies that has emerged around the previously 1990 and now also 95 strategies, where it's all about getting everybody who has been in risky behavior. So not everybody, but everybody who have been in risky behavior should be tested, and then through those contact people who they have been in contact or they may have infected, and test those. And then, of course, people get access to treatment. And then treatment have to be adhered to. So 95% should be tested. 95% of the people with risk behaviors should be tested. 95% of those tested should be get access to treatment, and then 95% of the people who are treated ideally should have undetectable viral loads, so that they cannot infect other people, so they themselves can stay healthy and not affect other people. So that's totally new, you can say. In that way, it's a new strategy, and TC is now also working within this strategy.
Now, as you reflect back on the gains in fighting HIV and AIDS, what are some of the notable achievements when you look across the countries that TCE has been in operation over the past 20 years? What can you single out? It could be maybe some of the selected ones that are standing a little bit much more unique.
Yeah, I think like any program that Humana People to People is implementing, you have to look at it from two angles. So one angle is that we have impacted the lives of 20 million people. 20 million people have met TCE field officer, have received information counseling. Many of them have been tested and have been able to make choices that otherwise they may not have done. So how many, we don't have the numbers, how many survived because of TCE, or how many, got access to treatment and so on in time and therefore survived because of TCE, but definitely they are there's a big number. So that you can see is a direct impact. Then apart from that, the response to HIV/AIDS was always a debate. Like when we started advocating for home-based testing from the beginning, I said that, why don't we test people at home? They can get counseling. But in the beginning, it was very strict. You had to almost have a PhD in counseling before you were allowed for a person to get tested. and so on. But this, as you know, as more and more experience were gained, then ultimately our field officers were allowed to do the testing. And that is also, I think, in most countries today, that is the norm. Our TCE field officers can do the testing themselves when they go door to door. And it's so this is, you know, I would say this, we have been part, I'm not saying it's because of TCE, I'm just saying TCE have been part of the whole ecosystem or the whole community of people fighting HIV/AIDS or fighting for better care and treatment of HIV/AIDS. So we have been a part of that. And in that community, we have been able to contribute with a lot of experiences of how to mobilize communities. You know, community mobilization have been a very important part of HIV/AIDS, of fight against HIV/AIDS in the past decades, and we have been part of that. The home-based testing, positive living, the whole concept of positive living, it's not us who came up with it, but we have really spread it and made it a household name in many communities. And then also you can say this, that it's really possible that also in poor community people can adhere to treatment. So in that way, yes, we have had impact on 20 million people, and we have also had impact on policies, on countries, and we have had impact on the whole, you can say, the whole debate and the way forward in addressing HIV/AIDS.
Now, I would like to come to the part where the achievements of TCE, looking at HIV and AIDS as a question, it has to have a direct connection with the government's health policies that are targeting HIV/AIDS as a major disease. Now, looking at the linkages between TCE and the health institutions in various of the countries that TCE has been in operation, how has such kind of a cooperation, such kind of synergies building supported the various efforts of responding to the AIDS as an epidemic?
So TCE has always sought to work together with the national AIDS coordinating organizations in the countries. So, you know, starting a TCE program, we always first contacted NACU or NACA, whatever they're called, and made agreements with the governments, consulted them on where to work, how to implement, and so on. So that's on one level. And then secondly, in the communities, we always worked with the health structures. You can say in the beginning it was informal, even though, for example, I worked in Botswana, so there we had a MOU with the NACO, or the National AIDS Control Agency, NACA, and then based on that we implemented our program. But then it was the field officers and the troop commanders that connected to each and every clinic in the operation area and made sure that we licensed with them, we told them what we were doing, and bit by bit we also find ways that we could support. So we brought clients to the clinic, we supported the outreach workers and so on. And then if you look at today you will see that TCE have become totally integrated in the national response. So very often TCE is funded by Global Fund, and Global Fund is either Global Fund or PEPFAR, USAID, or CDC, the Center for Disease Control out of USA. And these agencies are, of course, totally, I mean, they work 100% together with the national governments, and the programs that are designed are totally integrated with the national response to HIV/AIDS in the respective countries. So now it's much more defined formally what is TCE's role and what is the local health structure's role. It's defined, and they are, they integrate, fulfill each other's role. So that we have seen, for example, both in Namibia, to mention one example, there, every year you can say TCE has evolved and become more and more integrated into the national response. And now the new project that is going forward from now on then you can say, Humana People to People in Namibia, or DPP in Namibia, is actually being a kind of advisor to the government, or providing not advisor to the government, that would not be correct to say, but providing technical support to the government in how to implement, TCE elements in the national response in all the districts where TCE has not been implemented over the last 10 years. So this is a development there, because the policy is now to reach the whole country, and everybody reach 95, 95, 95, because I think 2 years ago, Namibia actually declared that they were very close to, if not already reached 90, 90, 90. So, and the same in countries like Mozambique, it's also very much integrated in the national response, and full cooperation in the local health services.
Earlier on, you have touched on the area of the new remodeled TCE becoming more streamlined, more targeted, responding to the gaps which are now being found by the researches being done either by UNAIDS as a UN agency, or a global fund as some of the funders. Index partner testing, if I recall earlier on, is one such particular remodeled approach which TCE is using. How effective is it in meeting or in responding to the UNAIDS 90-90-90, or now better, the UNAIDS 95-95-95 strategy to end AIDS by 2030?
First of all, I think it's important to understand that the 90-90-90 strategy, or the 95-95-95 strategies in different countries, is based on the history that I've already said. Countries have moved since, especially since I would say early 2000s. So we're talking about the past 20 years. People have really moved from stigma, not really knowing what to do, and then to having a more and more clear strategy of how to control HIV/AIDS, and now, as UNAIDS says, end AIDS. And the way to end AIDS now, the strategy is that every person should have treatment, and their viral loads should be below undetectable, because then they cannot infect. And of course, the strategy is also to continue that people should protect themselves in the first place, not be infected in risky situations. So of course, still it's also to advocate, give information about the use of condoms, and protect yourself and against HIV/AIDS in other ways. But ultimately, the idea is that people should know their status, and they should have access to treatment, and they should become undetectable. And in that way, one day the virus will, well, I guess the idea when you say stop AIDS is because then the virus will no longer spread, or to such a small degree that so I think in that, so TCE, as I said, TCE has also evolved, because then it's now all about getting people on treatment, while it's important to inform people also, because people have to understand what they do. If you just treat people mechanically and then give them the pills and say, eat your pills and then you'll be okay, then it doesn't work like that. People have to understand the seriousness. They have to understand what adherence means. They have to understand the concept of viral load. They have to understand the concept of not infecting others and how to avoid infecting others, and so on and so on. So, community mobilization, or mobilizing people. So the slogan of only the people can liberate themselves from AIDS epidemic still stands. Because even if the strategy now, because of the access to antiretroviral treatment and testing, is much, much bigger, or is universal in most countries, then it doesn't mean that, that still the person have to be mobilized to do it right. So I think in that way, TC is still very relevant. And I would say our people, our field officers are good at also doing this strategy, because they have the connection to the people. You cannot, this index testing, and you call it partner testing, testing, getting, let's say a person have, more than one sexual partner, and 4 sexual partners maybe, and then getting him to admit who they are, and then allowing the field officer to contact them to actually provide testing and so on. That demands quite sensitivity towards the person, as both the person who is the first one who was tested and his or her partners. So this kinds of sensitivity and handling of these kinds of sensitive issues also demands a very experienced and capable field officer with huge respect for the people. You know, respect is a very important word. It has always been the mainstay, you know, of doing this kind of community mobilization, is that you respect the person that you deal with. So no matter the circumstances, no matter, you know, what the background of that person, how he or she became infected, or how he or she is at risk, we should always show the greatest respect. It's a human being, and what matters is to work with that person to either stay negative or to become, you know, treated so that he or she becomes undetectable. So that's the very core of TC.
That is quite much more evident. Now, when you look into the future, how do you see Humana People's relevance in fighting major diseases?
I think, yeah, Humana People is very relevant in fighting diseases. Now we have talked a lot about HIV/AIDS because it's the 1st of December, the National AIDS Day. But I think also Humana People member organizations also do a lot with tuberculosis, which is another kind of, you can say, infectious disease. It's a bacteria, and it spreads in a different way. But it spreads very much about poor people who are living in overcrowded conditions. It spreads among people who have poor immune systems. So it's definitely a disease that, first of all, impacts the poor. And as Humana People in different countries, our main objective, as we discussed in the beginning, is to fight inequality and fight with the poor for a better life. Then, you know, fighting with people who are infected or at risk of TB is very important. So we have large-scale TB programs in several countries, and we also want to reach as many people as we can, because we are good at reaching the unreachable. We are good at working with people in the most dire circumstances. That's where we work. So, so TB is one thing. Malaria, of course, is a part of our community development projects, part of all our outreach projects. It impacts a lot of people in Southern Africa. Unfortunately, it has taken, you know, centuries, I would say, or at least decades, not to develop an effective vaccine. There were some good news a few months ago with a vaccine that gives some kind of protection. So that's really good. That we hope that it will be improved more and more, and you know, that people, or some of the money in the world, can be invested in finding an effective vaccine against malaria. In the meantime, we will continue to distribute bed nets and advise people on how to protect themselves against the malaria mosquito and how to access treatment in time so that they don't die from it. So that we will do. And COVID, of course, during this COVID pandemic, we have not particularly started COVID projects, but we have, in all our projects, we have engaged with our communities to spread the information about COVID so that people know what it is, and then also about you know, how to protect themselves, following the simple measures that you can follow to protect yourself against infection, and then now also helping people to get registered and access vaccines. So definitely Humana People will continue to be there together with the people in need and who are in difficult circumstances and in the poorer parts of the world to fight epidemics and pandemics.
Yeah. Now, as we have come to an end of our conversation, any last message you wish to share with us before we can call it a day?
I think what is important is is that, yeah, on a day like today, because the 1st of AIDS International Day for the fight against AIDS, is to, it's good to learn from history. And in the start, when we started working with HIV/AIDS, we also learned a lot from the pioneers who had started working with HIV/AIDS in the early 80s in USA and some of the European countries. The organization that were fighting for more, when antiretroviral treatment became accessible, then there were some, you can say, some very radical groups that advocated for access to antiretrovirals for all the people, not only the people that had insurance in USA and Europe, and then the ordinary people, who have been fighting the fight, but unfortunately died trying to survive, but they didn't. They died from it, and it's, there are millions of people who have died from HIV/AIDS, and we should remember them, and we should, also, because that should give us courage and strength to continue to fight, I would say, not only inequalities, but also injustice, because there's a lot of injustice in the way that people are treated around the world, and Humana People to People should also always stand for, respect of all human beings having equal rights, and that also means access to opportunities, and we should fight for that. And I think today, in the middle of the COVID-19 pandemic, we can still see that the fight is still there. It's we have a world which is so rich. There's so much money accumulated in certain bank accounts or wherever it is, and there are so much. The resources are there, the science is there, and we could actually end this pandemic if the vaccines were made available for all the people around the world. But because of what I said, intellectual property rights, and that those who own those intellectual property rights keep on them and profit before people, then it's not happening. So, people should go before profit. That should be our motto, and that's what we should work for. And so in the meantime, we work with the people to create a better world where they are around themselves in their communities, but we should also advocate for a more equitable world. So to end with, I think really it's UNAIDS have come up with a very good and powerful theme this year. So end inequality, end AIDS, end pandemics. We really support that.
Thank you very much, Snoore Westgard, the chairperson of Humana People to People, who spared a moment to share with us his opinions, taking us through a journey of Humana People to People over the years in fighting against HIV and AIDS. Also taking a reflection on World AIDS Day 2021 theme, End Inequalities, End AIDS, End Pandemics. It is quite a challenging theme, of which Humana People to People has over the years been part of responding to fighting HIV and AIDS, responding to some of the inequalities that are affecting the poor of the poorest in the world. It has been also engaging itself recently in being part of the progressive social movements that are adding a voice in making it possible for COVID-19 vaccines to be accessible by all, available everywhere, and free of profit. So we hope during the World AIDS Day, you will take a moment to reflect and remember some of the people who have passed on due to AIDS, the epidemic. Take it as part of building courage, which you are also to face some of the social injustices, social inequalities, economic inequalities, legal inequalities that continue to pose barriers into how everybody, somewhere, who form part of the key population, the most at risk, vulnerable social groups that are exposed, continue to be exposed even now to HIV and AIDS, some of the pandemics, which are resulting in the loss of life. So we hope again, until we meet, we would like to wish you quite a successful job you are doing in touching the lives of those people who are in need of support, who needs to be supported with dreaming again, having hope, and also strengthening some of their lives so that we achieve some of the United Nations Sustainable Development Goals in the areas Humana People is implementing such work. So from now, I would like to say this opportunity. Thank you very much for being part of this conversation where we invite some of the invited guests to form part of a discussion where we look and reflect at what Humana People is doing. So from myself, Elton Chinowaita, and the crew behind the scene, I say bye-bye for now.